I used to be a lot heavier than I am now. And at that time, my blood pressure was about 120 over 80. I lost weight. I'm now at 90 over 60. Is that...
That's not your weight, that's your blood pressure,
That would
right?
be my blood pressure. Is that normal to have a reduction in blood pressure when there's a reduction in weight?
Absolutely. It's normal to have that drop in blood pressure. You see, for every pound of fat, there's a mile of blood vessels.
Wow.
If you lose that pound of fat, you don't lose the blood vessels, but you stop perfusing them. You stop pumping blood through them. Now, let's say you lost 10 pounds. Well, that's 10 miles. How, you figure the heart pumps, it pumps 60 times a minute. There are 1,440 minutes in a day. If you do the math, you find if you lose 10 pounds, you're going to save your heart pumping blood to the moon and back every day.
Interesting.
That's incredible, and it takes a big load off your heart if you lose that weight. That alone will drop your blood pressure. Mm-hmm. The other thing that happens when you lose the weight is your insulin starts working better. You require lower levels of insulin to do the job in your body. Of course, the job of insulin is to move sugar out of your blood into your cells. Mm-hmm. As your insulin level drops, so does your blood pressure, because insulin raises your blood pressure. That's another effect of insulin.
Okay, very interesting. So is that why oftentimes people who have diabetes also have high blood pressure?
Absolutely. And with diabetes, high blood pressure is particularly troublesome because they already have arteries that have deteriorated. Then you add the high blood pressure to them and you have real problems. So with diabetes, we have a different cutoff for blood pressure. We say that in a diabetic, the blood pressure should not be 140 over 90 or less, but rather we say it should be 135 over 80 or less, or even preferably under 130 with diabetes. Very important in diabetes to keep the blood pressure down.
Okay. So we've talked about the numbers, and what I hear you saying is it's important for us to know what our numbers are.
Absolutely. If you have high blood pressure, you should get a blood pressure cuff, and you should measure your blood pressure regularly. Now, it's important how you measure your blood pressure. And it's important to understand that blood pressure is variable. In fact, if you measure your blood pressure and it's the exact same thing every time, you've got a problem with your heart. There should be variability in blood pressure. For instance, if we're sitting here today and someone opened the door and shot me, and I fell over in a heap, and then they said, and we'd like to measure your blood pressure. If your blood pressure wasn't up, something would be wrong.
Okay.
Stress raises our blood pressure. Exercise raises our blood pressure. Walking, it raises it. Eating raises our blood pressure. Lots of things do, and that's normal. When we want to measure our blood pressure, ideally, you should be sitting still, relaxed for at least 5 minutes. Your arm should be well supported, like on a table. Don't be holding it up. Should be well supported, about the level of your heart, quiet, then check your blood pressure. And then it should be around 120 over 80. That's ideal, or a little bit less. If you run around the table and sit back and take it again, it'll probably be high. If you rush into the doctor's office and have your blood pressure taken before you've relaxed, or if he's late, of course that never happens in my office.
Never.
Yeah. If he's late and you're a little anxious and looking at your watch, and then your blood pressure can be up. You need to be relaxed and take it then. That's the best time. Another thing is, if you get your own blood pressure cuff, and you should, if you have high blood pressure or if you have a history in your family of high blood pressure, get a blood pressure cuff, measure your pressure, get a good one, get one that reads it automatically. Don't get one that you have to pump up, because the act of pumping the cuff up will raise your blood pressure. So you don't want to do that. Get an automatic one, and take it into your doctor's office when you go. Check it with his or hers, and then check your blood pressure with yours, and make sure that they correlate. because if they correlate well, then you can trust it. I have many patients that come in, I tell them keep a record of your blood pressure, and their pressure is high or low compared to my cuff. And sometimes it's right on. It doesn't matter if it's high or low so long as you know what the number is and how to correlate it. But if you check your pressure regularly, you'll have better control. Know your own numbers. That's very important with high blood pressure. Know your own numbers.
So Dr. Howe, what actually makes the blood pressure go up?
Well, you remember we used to say that high blood pressure was essential. And then we changed the name from essential to idiopathic. Idiopathic really means I don't know why. But your doctor wouldn't say, I don't know why your blood pressure's up. He'd say idiopathic because that, kind of covers him a little. And then we changed the name to primary. But there are many cultures that don't have high blood pressure at all. No one has it. I spent 3 months in Nepal in 1998. I saw about 60 patients a day.
Wow.
And in that time, I only saw one patient that had high blood pressure. He had been in he had worked for the British. He was actually a Gorkha and had been in the armed forces for the British for many years and had adopted some of their lifestyle. As a result, I think he had high blood pressure. But as a rule, that culture doesn't have high blood pressure.
So you were there for 3 months and you only saw one person with high blood pressure?
One person with high blood pressure and only one person with heart disease, and they were the same person.
Wow, you certainly wouldn't find that here.
No. Their diet and ours differs quite a lot. The major difference, there was a very good review article in New England Journal of Medicine this past summer explaining the difference. The difference is our diets are high in sodium and low in potassium, whereas their diets and many primitive cultures are high in potassium and low in sodium. That is one of the major factors in high blood pressure, the development of it. If we could raise our potassium and drop our sodium, our blood pressures as a nation would go down. We hear a lot about fat and how bad it is for our hearts, but I think that it's very clear if you look at the data that high salt diets cause more heart disease and stroke than high fat diets do.
Interesting, because when you go to the supermarket, you get a box, a bag, a can. It doesn't matter what you get off the shelf. If it's been processed, the sodium content generally is very high. It seems that it's everywhere.